Okay, welcome everyone. Welcome to the Food Thinkers for this month, the July 2021 Food Thinkers. Our 2020-21 Food Thinkers seminar series brings together big ideas from women in academia, policy, business and advocacy on redesigning food systems. And what better topic to talk about today? What next for food taxes and subsidies? Lessons from pricing policies to address food and nutritional issues. Those of you who are based in the UK or others may have seen the recommendations coming out today about taxation on food in the independent review for a national food strategy. So this is a very, very timely topic, and I'm delighted to welcome Shu Wen Ng of the University of North Carolina at Chapel Hill in the US. My name is Professor Corinna Hawkes. I'm director of the Centre for Food Policy that hosts these Food Thinkers seminars, and I'm delighted to welcome you today. So before I introduce Shu Wen, I'd like to mention a few things. That first of all, that this webinar is being recorded, so you can share it with others afterwards, as it will be made available online via our YouTube channel. We're going to start with a 40-minute presentation and then have questions in the Q&A. And this week, this month, we'll also be having a little bit of interaction and asking you to put a couple of words into the chat as well. But when it comes to the questions, please put them in the Q&A box. You can start typing your questions right at the very start, and I will then moderate those questions for Shu Wen to respond to them. Please do fire away in all of your questions. It's great to have such an engaged audience that we typically have, so do fire away. We ask you most of all to listen, reflect and ask questions and comments. But if you do want to send anything out on Twitter, please do use the hashtag #FoodThinkers and the handle @FoodPolicyCity. You're very, very welcome to do so. And of course, we welcome that very much. Just to say that we will be taking a break in August, but we'll be back in September and we'll be announcing our new programme for autumn after the break. If you want to receive our event updates about these Food Thinkers, just type your name and email address into the chat function and just send it to the panelists, as that way it'll just come to that will just come to us. Also to say that we do get a lot of inquiries about our Masters in Food Policy, and so we'll put the link into the chat for you to see that as well. So it's good to see a great audience tonight, and I'd really delighted to welcome my colleague and friend, Shu Wen, who really has been incredibly important in building up the evidence base, both the rationale and the impact of taxes, and more recently subsidies and financial incentives as well. She's a health economist, trained as a health economist, and she's an associate professor of nutrition at the Gillings School of Global Public Health at the University of North Carolina, as I mentioned. And her work is really focused on understanding why people make the decisions, individuals and households, about dietary behaviours in the context of the constraints of money, of time, of biology, and the broader environment in which they're made. And she's a lead investigator and a co-investigator on lots of big grants, looking at big data sets with store sales, household purchase, and she co-chaired the United States sugary soft drinks tax evaluation advisory committee, and is also a member of the soft drinks industry levy in the UK of the study steering committee. And she leads ongoing projects around the world, South Africa, Jamaica, China, Brazil, and also consults for the World Bank, Singapore's Health Promotion Board, and in New York City as well. So a ton of experience and expertise that we're really looking forward to learning from tonight. Over to you, Shu Wen.
Thank you, Corinna, for this really wonderful introduction, and I'm really happy to be able to present at this month's Thinkers seminar. So I'm going to just jump right into it. Corinna has introduced the topic, and it indeed is very timely given the news from the UK today. So I'm sure we're going to have a wonderful conversation after at the end of this presentation. Okay, why is my slide not changing? Okay. Okay, so before I get into the content, I did want to start by acknowledging my collaborators and funders, many of whom are obviously at the University of North Carolina, but also in several other places, such as in Mexico's INSP, in South Africa, Berkeley, and then of course, several funders that have supported this work over the past 10 years or so, and other partnerships that we've built and established over this period as well. This type of work requires a lot of collaboration and cross-disciplinary interactions and listening and understanding. So, you know, and the dialogues are really important and inform on how we go about designing policies and then also implementing them, operationalizing and implementing them. So I do want to definitely acknowledge this huge group of people who have worked together over the years with me and with each other in this process. So just a general quick outline for this talk. I'm going to start with making a case for integrated and sequenced policies. I actually feel like I'm preaching to the choir on this, so it's not going to be terribly long. And then I'll jump into providing some of the evidence and identifying gaps around pricing policy options, focusing on two specific pricing policies, increasing prices to change demand and supply and lowering out-of-pocket prices to support healthy diets. And then I will just move into discussing how we can move the needle based on what we know. So I think, as I said, this audience probably is already very well schooled and understands the need for integrated systems approach in trying to improve our food environment so that we can achieve sustainable and healthy diets. Single policies alone will not do enough to make a difference. And so there is a need to take systems approach to tackle the syndemic of diets that result in poor health of people and planet, and to create triple wins for people, economies, and the environment. This talk is going to really focus more on the people and the economy mostly, and not so much on the environment, which I totally recognize is actually a gap right now in my work. But I think there are a lot of other people covering that area, and I am interacting with those people, but that is something that I will just acknowledge up front. This talk is not going to cover very much of. And there is definitely ongoing work in that area as well. So focusing on sort of the health and the economic argument side within this, I think the evidence is mounting around several issues. First, the consumption of ultra-processed products on weight gain. Here I've cited some recent work, and the cell metabolism paper in particular was one of the first RCT type randomized controlled trial, actually it was a crossover study trial on looking at ultra-processed product consumption and its impacts on weight gain and other cardiometabolic outcomes. And essentially what they found here is that the likely reasons or like the possible mechanisms behind that relationship could be due to the lack of satiety resulting in overconsumption. And it also suggests that reformulations alone are likely insufficient. Beyond sort of this the highest type, what's considered sort of the best gold standard in terms of science designs, study designs, there are also several cohort studies that have found strong associations of ultra-processed product consumption on cardiovascular diseases and mortality. Within ultra-processed products, sugary drinks are, in particular, I think the first in line to try to, focus policies on. And to date, you've probably heard the term sugar-sweetened beverages used most commonly. But of course, sugary drinks are not only comprised of sugar-sweetened beverages. 100% fruit juices are also sugary drinks. And in some newer studies suggest that even fruit drinks, 100% fruit drinks, may actually have stronger association with poor health outcomes than sugar-sweetened beverages, because they can at times contain more sugar by volume than some sugar-sweetened beverages. Beyond sugary drinks, other types of ultra-processed products are also problematic, as I've already mentioned. And so there is a need to try to discourage the consumption of ultra-processed products, as well as to encourage the consumption of whole, minimally processed foods. And again, there's growing evidence around this, and there's a push now to try to find ways to add minimally processed foods back into the choice sets that households and individuals face, and to try to change the relative prices of ultra-processed foods vis-a-vis whole minimally processed foods. So in thinking about integrated sets of policies, let's start by thinking about the integrated policies that can help discourage the demand and supply of less unhealthy ultra-processed products. So here I show sort of a graphic with a set of different potential integrated policies aimed at reducing desirability, affordability, accessibility, and availability of unhealthy ultra-processed products. And so given global trends, which I haven't even shown, but I think many of you are familiar with in terms of the growth of UPPs, these policies must come first, as opposed to the second one, which I'll describe later. And sort of the analogy behind this is that, in many cases, we're basically in a leaky boat, right? And if you want to try to not sink, you first have to, what do you do first? Do you bail the water out of the boat, or do you plug the leak? So, my argument here is that we really need to focus on plugging the leak first before you work on bailing the boat. So within the integrated sets of policies to discourage the demand and supply of UPPs, one option to operationalize what products are subject to these policies is to use what we call nutrient profile models. These can then focus on the nutrients of concern that have been shown in study after study to be linked with poor health outcomes. And these should also be strict and can be designed to get stricter over time in a phased way. And the purpose behind having something consistent, like using something like a nutrient profile model, is that it can serve as a basis across policies to ensure consistency. So then I think for me, I think what would be sort of the second stage of sets of policies would be, again, integrated policies, but now focused on encouraging the demand and supply of whole minimally processed foods. And I want to be clear that I think my opinion is that these sets of policies should really only be fully introduced after policies to discourage the UPPs have shown meaningful change and impact. Because like I explained before, with the leaky boat analogy, we need to plug the leak first before you bail the water out. This also protects against opportunistic industry voluntary efforts, which basically serve as delay tactics. The basis for these policies to encourage the amount of whole minimally processed foods are food-based dietary guidance. And many countries already have these. And obviously these should highlight whole minimally processed foods and should be accompanied by other supportive societal or community norms, such as cooking, eating with others, and eating seasonally. So, I've shown these two sort of stages of integrated policies. What is the purpose of pricing policies within these? So on the discouraging UPP side, it is to increase the price to change demand and supply of the unhealthy products we want to discourage. And then on the other side is to lower the out-of-pocket costs to support healthy diets. So I'm going to jump into now talking about some of the evidence, and I'll start with taxes. So I think many of you are familiar and have heard about the different types of taxes that are occurring globally, including in the UK. And in many of these evaluations and assessments of how these taxes are being implemented and the impact they are having, I think it's really important to also keep in mind, as you read and hear about this, who is responding to these taxes and how they're responding. So most of these taxes that we've been evaluating and discussing are what we call excise taxes. They are implemented and levied on the manufacturer or distributor. And so the collection is easier because you don't have to go to as many places or companies for the tax administrator to collect. They go to much fewer entities to collect the taxes. So we do need to think about how manufacturers or distributors are responding. And they can respond in a number of different ways, such as the degree of price pass-through, of the tax pass-through they pass on to the stores, which is next on the sort of the chain. Whether or not they reformulate their products, their package sizing changes could also occur. They might shift their portfolios to introduce some new products that may avoid the tax, and also how they go about marketing the products that they sell. How they respond is going to be driven largely by the tax design itself, their market share, and what the competition within if it's a SSB tax, for example, within the beverage market looks like, and then also their existing portfolio mix. Next down the line would be stores, retailers. And again, they are faced with the question of how much of the price increase that they experience passed down from the manufacturers should they then pass on to consumers or the public. They can also respond in terms of how they do their price promotions or volume promotions and their product placements. So they also have several options in terms of how they might respond. And their choices within those options will again depend on the tax design, what type of store they are, where they're located, and who their clientele is, and as well as potential stocking regulations that may exist depending on where they are located. And then finally, the public. So, as a consumer, how might I respond when I see the price of some beverages go up, right? I may buy less of it or buy more of it. I might substitute to other products, and how I respond will be a function of my price sensitivity, my income level, how much of the product that's now more expensive I used to consume, and therefore essentially like how much I want and like that product, right? Which partly is also driven by marketing. And then also perhaps if I have particular health concerns, I might start changing my behavior. So I'm going to describe a study that was done back in 2017 with our evaluation of the United States' first sugar sweetened beverage tax, which was implemented in Berkeley, California. This was a 1 cent per ounce tax, and so what we call a volume-based tax, excise tax levied on manufacturers and distributors. Berkeley, first of all, I should also explain that Berkeley is a small, pretty small geographical location, and it's surrounded by a number of other cities. So it was also quite easy for people who really wanted their sugar sweetened beverages and not pay the extra 1 cent per ounce to go somewhere else to buy their drink, right? So we saw though that within Berkeley, there was an increase in the price of SSBs, but this did vary by the different store types, because as I mentioned, the stores do have a bunch of different ways that they can respond. And so we did see that chain stores increased the prices of SSBs, but pharmacies did not. And then, for example, and then in the larger grocery chains within Berkeley, sugar sweetened beverages fell by about 10%. But untaxed beverages sales actually rose 3.5%. And because their volumes for untaxed beverages were higher to begin with, the overall beverage sales actually rose slightly. As a result, there was no change in the store revenue or grocery bill spending within Berkeley stores. So this actually was also a win for the retailers because they didn't actually suffer a revenue loss due to the tax either. So a win in terms for the, for the community, for the population, no impact for revenue for the stores, and tax generation for Berkeley. Okay, so another tax then, local SSB tax that was implemented in the US was in Philadelphia. This came in January of 2017. And the evaluation of this found about a year later, with a year post-tax, found that the tax there cut consumption by 1.3 billion ounces and sugary drink sales fell by 38%. Oops. Oh dear, I lost my set of slides associated with that. Sorry. Okay. Do you see this now? Okay. So I would like the audience members to try to do something interactive here now. As I read these quotes, please put in the chat some of the themes you're seeing, or how do you think the people saying these things are interpreting the SSB tax? So let's start with this. It's just not right, he said, complaining that prices on his favorite brands had nearly doubled. He headed to the cash register, leaving behind the 2-liter bottle of Days champagne cola he coveted. I'm on a fixed income, so I have to watch my spending, said Mr. Foster, who has high blood pressure. Plus, my doctor says I've got to lose weight. Okay, another quote here. Despite his disdain for the measure, Mr. Foster acknowledged the tax was having the desired effect. He helps take care of his 5 grandchildren. They just drink this stuff like it's water, he said. Now, if I could only get them to drink water. So, Corinna, can you help? I can't see the chat, so you're gonna have to tell me what people are typing in.
Sure, so I've got one word so far, paradox, and it's the expected result of the tax. Awareness. Constraints.
Mm-hmm.
Yes, this is the challenge to changing behavior.
Mm-hmm.
Rational decisions, alternatives.
Right.
And nudged to a healthier choice, communication, learning, right implied morality elements.
Mm-hmm.
Interesting, acknowledging a desired outcome after saying it wasn't right. Knock-on effects to family. Resentful acceptance.
Yeah. Okay, thank you, Corinna, for your help with that. These are really, really great comments and very insightful. I think you all caught a lot of the sort of themes that were coming through as well. I just want to highlight a few that I noticed. So the first was, I think somebody mentioned, resentment, and then also constraints, right? So yeah, so here, it's just not right. I'm on a fixed income. So this sort of speaks to one of the concerns that comes up whenever we talk about SSB taxes, which is that it's income regressive for people who might be constrained financially. So this comes through here. And then there's also these pieces, leaving behind the 2-liter bottle. Now, if I can only get them to drink water. So here you're seeing some of the behavior change elements, right? And then has high blood pressure. My doctor says I've got to lose weight. So that here we see sort of the connection piece. This person at least seems to be making the connection between the consumption of SSBs with losing weight and blood pressure. So there's some development of linking the issues as well that's occurring. So I guess the point I was trying to make with showing some of these quotes is that it is also possible that the text in and of itself is beyond, the impact of the text is beyond just the sort of financial impact, right? It can also spill over to some of these other aspects, like recognizing the links to the health outcomes. Okay, so I also wanted to, sorry, my slides somehow went out of order, present very quickly about some of the other work that I've been involved in Mexico. This was a very early study we did where we looked at the price pass-through. And this figure just helps to illustrate that, again, like I mentioned in Berkeley, the price pass-through is not always uniformed across beverage types or locations. Here, I think this figure does a good job illustrating that even within sugar-sweetened beverages, here carbonated soft drinks, CDS, there was variation in terms of package sizing. The pass-through was higher among smaller package sizes than larger package sizes. And then within sugar-sweetened beverages, the juice drinks all had a lower pass-through compared to carbonated soft drinks as well. And then in South Africa, some recent work there evaluating their sugar density-based tax showed that, for products with, we saw both reductions in both the percent of sugar people were getting from beverages as well as the volume. But the reductions in sugar were larger than the reductions from volume, which suggests that there was reformulation occurring, right? So when you see, if you look at the figure for all taxable, that first row, a 51% reduction in sugar versus a 29% reduction in volume of sugary drinks. We also found that there were differences in the response between the lower income, here we use living standards measure, lower living standards households compared to higher living standards households. So lower income households were much more price responsive than the higher income households. And accordingly as well, the amount in which they reduced by were a lot more. That should be a negative 229, by the way, that got dropped. So there is a difference by income. This is consistent with theory, with economic theory. Lower income households would be more price responsive. We found similar results in Mexico as well, and in some other countries where evaluations have occurred. Okay. Others have really done a great job in consolidating and pulling together the evidence around sugar-sweetened beverage taxes across various locations. PAHO recently published this review, which I highly recommend looking at. And I think that's a nice job, both in terms of the narrative reviews as well as the meta-analysis that then is able to provide more of a global view of how these taxes might be impacting price changes, purchasing or sales and consumption of sugar-sweetened beverages. And generally, basically, we're seeing that these taxes are mostly designed as excise taxes because, as I mentioned earlier, they're easier to collect, implement, and it helps with the framing because if it's talked about as taxes on industry, the public is more willing to support that versus framing it in terms of a consumption tax or a tax that consumers suffer from. That said, industry can pass through or respond differently and can cost shift in different ways, as I've illustrated earlier. And price responsiveness by the public can really vary across subpopulations as well as over time. I didn't present results in that, but we did actually see that in Mexico, in the second year of the tax, the reductions were actually even larger. So there was also that impact over time in terms as people's habits might change and preferences gradually evolve. Also, meaningful taxes, if passed through onto prices efficiently, can shift demand for the taxed products and sometimes also the untaxed products, which could be healthier, but then that's a function of what products are covered by the tax and what are exempt from the tax. And there's actually a lot of debate around that. And then taxes as well, along with media and education, probably is still not enough to radically slow down and reverse obesity and NCD trends. I'll discuss this a little bit more further on, but the reductions that we're seeing, even though they can be significant, it's not going to suddenly change some of these health outcomes, right? It's going to take a long time and sustained reductions in order to see sort of the health outcome changes. So more needs to be done as well. And then also, we're not seeing changes in employment. This is an important point to make because industry often argues that SSB taxes is going to be detrimental to the economy and employment in their sector as well. What we're actually seeing is that there's actually no impacts on their employment because in some cases, people are shifting to buying other beverages, which still goes back to these companies. And even if people are not buying the sugar sweetened beverages or substituting to other beverages, and maybe drinking tapped water more instead, which is what we want to promote, people are still using their money in other ways, right? So whatever money they're saving from not buying SSBs, they're redirecting it for other things. And so the money is just being shifted to in a different sector in the economy. So there is still that global economic activity that's occurring. And then finally, context in the framing does matter. I'm going to discuss it a little bit more later too. Okay, so why might taxes work? I've mentioned that it probably works because it also sends signals to consumers and producers, such as them learning about the health implications via the campaigns. And in some cases, depending on how the tax is being messaged at the stores, potentially salience at the point of purchase, meaning that if there's some signage that might be calling out the existence of a tax, this is why the price of this product has gone up, is because this tax is now implemented here. It actually can increase the salience of the tax and why there is a tax, and may actually change behavior even more in terms of reducing its purchases. Tax is also correct for what economists call externalities and internalities. So externalities are things, outside of the person. So like the spillover effects, right? Such as the potential longer-term healthcare cost implications, as well as the direct and indirect losses in productivity, right? So if people get ill because of drinking a lot, overconsumption of sugar, and are unable to work, there's loss of productivity there. And then if they therefore need a caretaker to help care for them, there are also those indirect losses in productivity for the economy. And then there's also the internalities, which are biases that we all have, right, around how we think we might behave, right, down the road. So, and part of it is due to a lack of information or understanding or a lack of self-control. So taxes can help correct for these measures, these issues. And then finally, the long-run benefits are likely larger than the short-run costs. But how you do that calculation is going to be a function of what you think their appropriate time horizon is, right? So is it 5 years? Is it 10 years? Is it 30 years? Is it over a person's lifetime? Those issues are going to affect how the costs or the benefits net out, right? It is still too early, actually, to observe the long-run benefits. There are a number of studies that have modeled the long-run benefits and tried to convert them into dollar figures as well in terms of potential healthcare cost savings. But in terms of what's observable, it's still relatively early for that. Although I would argue that we do need to be looking at it and tracking that. And then the short run costs, it's not too obvious right now what the bulk of them will be, other than the implementation of the taxes themselves, given that there's no evidence of employment effects in several countries that we've looked at. And then when might taxes work better or worse? It's going to depend on several issues I've already touched on, right? There's heterogeneity or variability in the response on the supply side as well as on the demand side that needs understanding and is going to be context specific, right? And then the text design also matters, and how much what goes into the text design and to have the desired impact will depend on the context. So this includes things like what products are actually included or exempt from the tax. We call this a tax base. The structure of the tax, is it what we call ad valorem or value or percent of value designed tax or specific tax? And if it's a specific tax, is that based on the volume or the sugar content, such as in the UK or South Africa? And then, of course, the level of the tax, right? Like, is it 18 pence? Is it 24 pence? Like the hit, basically, like how large this tax is going to be is also going to drive, the outcomes. And then finally, I touched on this earlier when I talked about Berkeley, the geography also matters. Locations that have taxes with a lot of shared borders with other cities or countries where there's very easy sort of flow of trade and purchasing behavior, you're going to have what we call leakage, right? And so those issues can also be a factor to keep in mind. So small geographies like Berkeley is going to have a higher probability of people doing cross-border shopping. And then the revenue use is another big issue. And there's great debate now, I think more and more debate about, particularly because of COVID, I think, whether or not the revenues from health taxes more generally, such as SSB taxes or tobacco taxes, should be earmarked for health promotion. And governments generally do not like to earmark revenue sources because they want to have the flexibility, given year-to-year needs of expenditure, to be able to dedicate funds in different ways. In some countries, it's also constitutionally not possible for them to earmark. So this is an ongoing challenge in terms of how do you encourage the direction of revenue from these sort of taxes towards health promotion. So that's something we can also discuss. And there's also this concern then that even if you were able to do that, right, in many ways you can basically say that the money is fungible, right? Whatever goes then into a particular effort, let's say gets directed towards, is earmarked towards efforts by a Ministry of Health, it's also possible for a country's treasury or Ministry of Finance to then say, I'm just going to take the money out from somewhere else, right? So there's that concern as well. So I think one possible way would be to set up dedicated funds or foundations, such as what Thailand has done, taking 2%, I think, of their revenue from alcohol and tobacco taxes. So that might help serve as a potential model for countries to explore. So there's still actually, even though I've said we know a lot of stuff, there's still some things we don't yet know. And I think there's room for refining and improvement. And again, adapting for each country's context. So the big one big one is how to minimize industry's response that dampen the effect of taxes, such as through strategic cost shifting. So I think there is actually a need to invest more to study this question, to understand their current responses, and think about how the designs can evolve to try to address this. Are sugar-based taxes more effective from a long-run health standpoint? Currently, model-based results suggest that that is the case because sugar-based taxes are going to encourage reformulation on the supply side. And so you're going to have greater reductions in sugar than just the volume reductions. So that does suggest that that's the case, but it's going to come at the expense. There's a trade-off then with the potential tax revenue. So that's a choice that policymakers will have to make in terms of what they're going to prioritize. Also, there's a need to better understand the manufacturer/distributor versus retailer versus the food service response. So these are various components of the supply side, right? We shouldn't actually really be thinking about the supply side. It's just one big entity. I think it's important to consider the flow of food and therefore, how the prices are passed on, price increases might be passed on, and consider how there might be ways along this chain to improve sort of the effect of the tax or minimize efforts to dampen the effect. And then, of course, which subpopulations will consistently respond more. This is also key in terms of understanding how these policies could be designed to narrow existing disparities that we see. And the role of messaging in media rather than the price effect itself is also, I think, interesting to understand because, sometimes even when tax campaigns fail, because of sort of the media and around the issue and debate and discussion around the issue, that can also have impacts on behaviors. And then the next issue has to do with then, the additive or the potential multiplicative effects of complementary policies. So I've been talking about taxes so far. What about expanding taxes to beyond just SSBs? And then also thinking about ways to support healthier eating and encouraging substitutions to healthier foods and drinks. So that's what I'm going to shift to next. Some work that I've been involved in around taxes and subsidies. So this looks at, the different demand elasticities between high and low fruit and vegetable, as well as sugar sweetened beverage purchases. And then we use that to simulate pricing policies around a national level tax in the US, with and without and with a subsidy on fruits and vegetables. So we tested a 30% subsidy to low-income households that are SNAP eligible. So in the US, we have a food assistance program called SNAP, and then a 50% version of it. So before I go into those findings, I did want to just point out some interesting, descriptives about the data and the population, actually the purchasing behavior in the US, which is important to understand because that will help you understand the differential effectiveness of the tax and incentives for different subsets of the population. So first of all, low income or SNAP eligible households tend to buy more SSBs. Households heads with lower education also tend to buy more SSBs. And then higher purchasing households use more than 10% of their food expenditure on SSBs and a lower share of their expenditure on fruits and vegetables. So that's just a key, sort of descriptive to understand. So what did we find when we did this simulation? So this is under just the 1 cent per ounce tax. So first we found that higher purchasing households were less price responsive compared to lower purchasing households. So if you look at this table, that top row, you'll see that higher consuming SSB households in the 75th percentile reduced their SSB purchases by 26% compared to lower purchasing, the 25th percentile households, which would reduce their SSB purchases by 37%. So that suggests, the higher purchasing households have a stronger preference for SSBs, so they're less price responsive. But when you look at the absolute values of how much they reduced by, which is the numbers just below those two numbers, you'll see that the high SSB purchasing households reduced their amount by about 6 times that of the households in the 25th percentile. And then also when we look and stratified analysis by SNAP eligible households compared to non-eligible households, we see what we've always seen in terms of the income issues, which is that SNAP households are much more price responsive. So, and again, the absolute values are quite large for the high SSB purchasing households. So I think one of the key points here is that elasticities are useful to know because we need those to be able to estimate the potential revenue generation and responses, but the clinical and the health outcomes come from the absolute changes. So knowing what the potential absolute change might result in is going to inform on sort of the longer term health implications. And then we also then calculated what the financial impact of the combined 1 cent per ounce tax with fruits and vegetable subsidies would look like among the SNAP income eligible subset of the data. So here you'll see in the figure on the left panel, based on with the 30% fruit and vegetable subsidy, and then on the right, the 50% one. So the red dot is going to basically tells you that, and line tells you that SSB tax is more impactful for higher baseline SSB purchases. We saw that in the table before as well. And then the fruit and vegetable subsidy, which is the gray and the black dots and lines, show that what their changes in fruit and vegetable in, purchasing would look like. And you see actually that's pretty flat across the SSB purchasing distribution. So there doesn't seem to be a strong sort of substitution effect between those two, between fruits and vegetables versus SSBs. And then in the bottom panel of each of these figures, you'll see the net effect, which is how does the sort of benefit from getting the subsidy net out from the tax that they experience. And so if it goes into a negative, it's not so ideal for those households, right? And we see that with a 30% fruits and vegetable subsidy, it's generally positive for most households, except for those in the 75th percentile and higher. So if you actually, if the subsidy was increased to 50%, however, even for high baseline SSB consumers, they actually have a net positive financial effect. So we're going to be building on this work to go beyond just SSBs, to also look at taxing other unhealthy processed products. And then on the incentive side, also go beyond thinking about fruits and vegetables to also include whole grains, water, and unsweetened milks, and do a whole system approach to then look at how the price changes due to these types of pricing policies can impact changes in packaged food purchases and the resultant nutritional outcomes, as well as generate potential revenue for the government. And then, some of that revenue being directed towards financing the healthy incentives. So I'm actually aware of the time and I'm running a little bit late. So I'm gonna very quickly just talk about some new program evaluation work that I'm doing that's focused on healthy incentives and subsidies. And the purpose behind sort of shifting some of my work in this direction is to try to add evidence around whether healthy incentives can support healthier diets and provide other spillover or positive wins for retailers and the healthcare, and as well as healthcare cost savings and therefore health insurance companies. Of course, also COVID-19 has brought along new challenges around food and nutritional insecurities. So I think pushing around on thinking about healthy incentives is also really critical at this time. So that was another reason I started moving towards this area. And then if possible, I think, it'd be important to try to make a case for healthy incentives to be funded and therefore sustainable through some existing mechanisms if we can show scalability under federal food assistance programs such as SNAP and or federal health programs. In the US, we have Medicare, Medicaid. There's also the Veterans Affairs health system and TRICARE, which is also Department of Defense related. And then there's also private health insurance, like I mentioned, as well as state level options. So it doesn't always have to happen at the federal level. States also have options to build in some of these incentives. I've been involved in working with a relatively new partner. I guess I've been working with reinvestment partners for about a year and a half now, helping them evaluate two of their programs, which are similar in terms of the incentives, which is basically a $40 per month fruit and vegetable incentive that covers fruits and vegetables with no added sugar, added sodium, or added fats, to use at a chain retailer with about 500 stores, mostly located in low-income communities in North Carolina. And I'm not going to read through all of this, but their reach varies and the length of the time varies. The two programs I'm going to be I'm working on with them on are Super SNAP and Healthy Helping. Super SNAP is longer running, and participants in that program may be in there for as long as 2.5 years, whereas Healthy Helping was a short-term relief, COVID-19 relief program, where participants were only in there for about 3 months. But the reach is quite different, with Healthy Helping reaching about 37,000 North Carolinians. All of the participants in these programs are current SNAP participants as well. So we have some findings from the Super SNAP program that I'd like to talk through quickly. So first of all, I think it's important to understand what population we're even discussing. So prior to actually participating in the program, many of these Super SNAP shoppers were food insecure, 92%, with 77% of them doing the majority of their grocery shopping at this specific retailer. And they were spending about $34 a month on fruits and vegetables, nuts and legumes. And while they were on Super SNAP, they increased their spending on total fruits and vegetables, nuts and legumes by $32 per month. Remember, the incentive was $40 a month. And this translates to increasing fruits and vegetables by about 2 servings a day, and an increase in their share of expenditures on fruits and vegetables by 15%. They also, because we were worried that, if you give people more money for a targeted set of products, they may just shift their budgets and use whatever they can save from the out-of-pocket on other things that may not necessarily be healthy. So we also wanted to see whether there were those, potential spillovers to other purchasing. But we found that they had a reduction in their spending on sugar sweetened beverages by about $2 a month, which translates to about 4% reduction in the share of their expenditures on SSBs, and 4.5% reduction in the share of their expenditures on foods to discard. And then also they spent about $30 more per month at this specific retailer. So there's a win here also for the retailers. They got to increase their revenue, they gained some new shoppers, and then gave them an opportunity for some positive publicity. I'm not going to have time to go into this Healthy Helping study, but we applied a mixed methods approach here, and also collected some qualitative elements, which I think this presentation will be shared, so maybe you can read through some of this at some point. Okay, so to wrap up, I want to talk about how we can move the needle with what we know. So on taxes, I think there is actually really ample evidence to push ahead with continuing having taxes, pushing for more taxes globally, and then also thinking about how to expand them to cover more products that are considered unhealthy. But the designs can be further improved if the policymakers and the politicians can commit. On the healthy incentives and subsidies, this is still on the relatively early stages. But there is some evidence that's trying to develop, not just from my own work, but other people as well. And there is a need to do more pilots using different mechanisms to improve the implementation and reach different subpopulations. Options on how this can happen is really going to vary based on the context and setting. And other venues and routes include school feeding programs, and of course, conditional cash transfers that are often already used in many low and middle income countries. And then there's a gap, though, I think, in the literature on the longer term impacts of these pricing policies, as well as understanding the intergeneration impacts of the policies on health outcomes and like learning and productivity outcomes as well. So I think I actually fall in the camp, even though I've been working on pricing policies for a long time, that they're really promising and they can make a difference, but they're not going to be enough. They need to be part of a package, right? We are seeing that the current levels of UPP consumption is still too high in many countries, whereas the current levels of less processed or whole foods are too low in many countries. And so then, basically the question is, we have pricing policies, we're trying to implement them, we're trying to improve them, but are they still too blunt of an instrument? So, this is my proposal for how we sharpen these instruments. Designing well-targeted pricing policies that account for the heterogeneities across the population and focus on narrowing the disparities. There's a need to also integrate with other policies, such as front-of-pack labeling that are effective, and marketing regulations, as well as like what's allowed to be available in schools, for example, in hospitals and other public settings. And there is a need for both what some people call budges and nudges. So I'm going to end with this, and thank you all for your attention. I'm looking forward to our chat, Karina.
Great, thanks very much, Shu Wen, for that very comprehensive view of the evidence of different aspects of fiscal policy and the importance of putting them into a more integrated policy package that you set out at the start. So we've got some questions coming here, and please do, participants, please do keep them coming in. I'm actually going to start with the one that's come in most recently from Martin White, who says the National Food Strategy report, which we were talking about earlier, for England, recommends volume-based taxes on salt and sugar as ingredients for manufacturing in processed foods. What do you think are the merits of this kind of tax that is more upstream in the food system and ultimately therefore targets a wider range of foods?
Yeah, that's a good question. I haven't had a chance to look at this strategy document, so I don't know any of these details. So Karina, can you actually help me a little bit here? So it's volume-based, targeting the nutrients?
So it is volume-based taxes on salt and sugar as ingredients for manufacturing. So it targets manufacturers.
I see. So they're making sort of the producer's cost higher, and indirectly hoping.
Yes, exactly. Yeah.
Right, and indirectly, I think hoping to encourage producers to cut down on salt and sugar.
Yeah.
I have concerns actually about that, because really when you look at the cost of manufacturing these ultra-processed foods, the ingredients are a relatively small portion. So in terms of, it would have to be a really, really huge tax on these ingredients to make a difference. So, not knowing what that looks like, it's hard to tell what the potential impacts would be. But if it's based on, so I don't think it's impossible, but I think the devils are in the details, like most things. And it would need to be have to be a meaningful tax, I think, in order for that to really have an impact on the price of the products, and then encourage, and because of that, encourage the manufacturers to cut the salt and the sugar. Yeah.
Thanks, Shu Wen. I'm going to continue with the National Food Strategy theme, recognizing that you haven't had a chance to read it, of course, Shu Wen, but Katie makes the point. I also listened to this interview this morning where Henry Dimbleby, who's the name of the person who was tasked with preparing this independent review, who was interviewed on the radio. And he said that the interviewer asked Henry Dimbleby about, isn't it just rich people or posh people telling poor people what to do and taxing them and so on? And you obviously gave an example of someone who was speaking about that in your presentation. And the response that Henry Dimbleby gave was that it's actually only posh people who raise the concerns that this is unfair on people of much more modest means. And actually his experience of going around the communities in the UK and his various deliberative dialogues that were conducted as part of the National Food Strategy was that people in disadvantaged communities wanted the government to act and wanted to be interventionist. So in line with the comment that you made in your presentation, is that something that you're able to comment on or have experience of?
Yeah, so I think, just taking the example of Mexico, where actually they did some polls before the tax came through in Mexico. This was back in 2013-14, I believe. And the public were generally supportive of a SSB tax in Mexico across, different social demographic characteristics. They were even more supportive when there was a possibility of the tax revenue being used towards supporting, like in the Mexico's case, putting safe portable water fountains in schools, particularly in rural areas. So there were, I think people are not unsupportive of such policies. I think it's a convenient sort of argument that gets drummed up and amplified, even though actually it's not. The poll after poll in different locations like Mexico and Berkeley. I think even the UK, Martin might have some of those numbers on the tip of his fingers. There is broad support for these types of policies, especially if the revenues are going to be redirected towards health promoting efforts.
And so thank you. And Isabel asked the question about how can we make sure that higher food taxes don't adversely affect the ability for those to low income just afford enough food, or sufficient nutritious food. Do you think that's an issue?
Yeah, I think so. This is where I think the sort of a set of policies are going to be critical, and I think one way to think about this is what money then people may not be spending on sugar sweetened beverages, they can now be using towards something else that hopefully is healthier, right? And supportive of a healthier diet. So, so there's that impact, it's the more short-term impact. There's also sort of the longer-term implications of, some have, I agree, actually, the SSB tax is actually progressive for health, right? Because in the longer run, it benefits lower income households in terms of being able to maintain or their health or become healthier, and therefore minimizing their downstream healthcare costs. I know the UK, for example, has their NHS, but many other countries don't necessarily have that kind of a system. But regardless, so it's either borne by the individual or borne by society, right? And if it within a NHS type system, right, you all indirectly will get essentially taxed for poor health, right? So the question is, who's paying for it and when are they paying for it? And does it make sense to actually then make the investment earlier on to try to reduce the consumption so that you have much larger cost savings down the road across the population, and arguably particularly among lower income households who, for every dollar like that, that stretches further for them, right?
Thank you. And Angeline's got a question about children and adolescents. She says literature shows that a tax on SSB seems to be less effective in reducing consumption in children and adolescents rather than adults. That's her understanding of the evidence. Is that also your understanding of the evidence? And if so, do you know why?
That's a great question. I don't know the answer to that on SSBs. I'm wondering if that literature, okay, so I actually know which paper you're talking about, yes. So that may be a function of just how much more kids seem to like value sugar sweetened beverages, right? And I would suspect that a lot of it has to do with marketing, and marketing sugar sweetened beverages as, cool and fun. I think there needs to be much more specific research around this issue to understand why there are differences in responses by age groups. And there is some more work now, I think, that's being done looking at, the package marketing. So what's actually on the package, the images that are used on products that might have child appeals, but also in terms of like social media marketing now, increasingly digital marketing, TV, and other media, other forms of media. That may be, part of what is happening, and which is causing them to just have a higher demand and therefore less price sensitivity to taxes.
Yeah, good point. So another one about the design of taxes from Barbara. She says, in your next stage of your modeling on taxes and veg subsidies, you're talking about taxing on unhealthy ultra-processed products. Are there particular product categories that you're targeting, and what model are you using to define these?
Right, so we are doing what we call demand systems modeling. So we're looking at the whole set of various food categories all together as one big system to account for substitutions that people might be making across different food and beverage groups. So it's pretty complex. But unfortunately, we have some really large data sets that we can do that for, and also be able to look at different income groups responses as well. And so trying to understand potential variability in their demand elasticities, basically. The question was on, sorry, I lost that detail.
The question was about whether there was particular product categories that you're
that's right.
targeting, and what model you'd use to define them.
Right. So in the US setting, we're going to be basing what we will focus on in terms of what are sort of the higher consuming ultra processed products that exceed certain thresholds. We're going to be trying to apply nutrient-based thresholds following models applied in Chile for their front of pack and marketing regulation policies. So we're going to be taking policies that we have already been implemented elsewhere successfully, and then applying those similar policies to the nutrient thresholds and the design to the US setting. That's how we're approaching this, because we don't want to come up with something totally new, right? We want to base it on something that's already been actually tried and proven. So that's our approach for this work.
Okay, thanks. And lots of technical questions here. So I'm going to focusing on the technical questions right now. We talked about consumer substitution to other food types affecting the actual health impact of these policies. And Penny asks, how reliable do you think cross-price elasticities are in describing these effects when trends and preferences change over time, particularly with education and the media, she says?
Yeah, so that's a really good question. I think what we're trying to do is use the most recent years of data to build these simulation models. So it's sort of our best guess as to what the price elasticities would look like and preferences are like. It is true that those can evolve over time. I think I would not recommend doing this kind of work using pretty old data for those reasons, right? Like the media issues and exposure to new information and all of that can play a role. So that's, we're doing the best we can with available data. And, this is why sort of, doing policy relevant work in a time sensitive way is so important. Because if you're using older data, it may no longer be relevant for the policy you're actually trying to inform on.
Thanks. And another technical question here. I'm going to read it out because I'm not quite sure if I will get it right otherwise. So it's from Melissa, and she says, how do you reconcile the modeling that shows a sugar-based tax may be more effective than volume-based for health, with emerging evidence that ultra-processed foods contribute to weight gain due to the nature of products, and that reformulation alone may not address the health concerns of these products? Ah, yes, I see what she's saying.
Yeah, no, it's a very, very good question, right? So let's say in the example of SSBs, a sugar-based tax is going to encourage reformulation to replace the sugar with non-nutritive sweeteners, artificial sweeteners. So you still have the ultra-processed product, right? Like it's in some ways hasn't changed, even though the sugar content has changed. Yes, so really this is a question in some ways of, do we push for harm reduction or do we push for incremental improvements? Harm reduction is the incremental improvements, or like just a wholesale shift, right? And so that is a really good question. I don't have the answer. I don't know if anybody, any of us actually has the answer. I think it's tough. It's this is an ongoing issue that public health, people in public health, are constantly debating. We saw that also, in some ways on alcohol, in the realm of alcohol and also in tobacco, right? Like, do you get people to shift to lower alcoholic content beverages or drink, like those sort of things? There are some analogous aspects, but I think food is much more complicated because we all have to eat, right? So I think this is really tough. I don't have an answer. I would love to hear, actually, Corinna, what are your views on this?
Well, my view is that everyone should do what they can. In the sense that I think that's what leads to social norms change, that it becomes normalized that everybody's doing something, even if that something is not the kind of real systemic change that needs to happen. And reformulation is not systemic change, and reformulation is often what happens as a result of a tax. And that even though taxes are, as all the evidence you've set out, it's and you've also said it's only one of the things that need to happen. So it's the more that people do, I think the more likely it is that it'll spread, that there's an understanding that everybody has a responsibility to act, to do something about it. Therefore, I'm in favor of that. The issue is that if this one issue then gets all the political attention, all the traction, and that takes away from other areas, that's what I think the risk is. But because there isn't enough action in this space anyway, I think it's important to take action that's possible, including through a tax, and to continue to spread as if by a network and so to get everybody to act. So that's my opinion.
Yeah. I also think that, there's going to be naturally some variability in terms of the policies chosen by different countries or and locations, because of the differences in politics and context, what's politically feasible, what's seen as politically feasible, I guess. So, you know, I think at some point then there will be, and in parallel to that, you have, you know, hopefully improvements in our understanding of some of these other additives as well. And, you know, and more evidence around the harms of ultra processed products on health, you know, growing evidence on it. So my hope is that, you know, the combination of these things will over time make it much clearer to everybody what the better, quote unquote, choices might be. And, you know, I think we just need to get more evidence and like really study the evidence more. Yeah, and keep monitoring it.
Yeah, I agree. Okay, going to shift gears to some questions more about the agricultural part of the supply chain now. And Jack's got a question asking if you've ever studied any of the instruments in agricultural policy as a means to raise or lower prices and to prescribe the quantities of foods that are available. And if so, or even if not, what is your views on the potential of instruments in agricultural policy to change prices?
Yeah, that's a good question. I have not done work in that area, to be honest. I've read a little bit in that area, but I've not done actual work in that area. In terms of my views on it, I think that it could be possible. It's not clear to me, I guess, like fully what the mechanisms for that would look like and how it would be implemented, and therefore what the potential sort of trickle down of the subsidies on the agricultural side would then, how would it then translate to what the public experiences in terms of, you know, prices of fruits and vegetables and other healthier products, nuts, for example. So that's the piece that I think is always, I think needs more investigation. Like, what is that mechanism? You know, how is that actually going to operate? So this is sort of why I've chosen to focus more on sort of the giving the money directly, or the incentives or subsidies directly to consumers, where it's much more clear who the target is, you know, and select consumers, right? Not just anybody, like, but people who need the support. You know, like I did in my my presentation showing, looking at incentives for like in the US SNAP populations. So I just feel like the more direct allocation of resources, if possible, would stand a higher chance. It's also going to help in terms of, I think, the political framing, in terms of, you know, knowing that there are specific populations that are going to be supported or helped through these incentives or subsidies, rather than going through the producer route, where increasingly in many, not all countries, but many countries, you have a consolidation, like, you know, conglomerates who are actually, you know, have a, you know, control much of the agricultural supply. So that's the other piece that I think would be important to sort of highlight, which is that targeting specific populations versus, you know, directing the resources towards essentially increasingly more and more conglomerates.
Great, thanks for your view, Shu Wen. So we've got a couple here about meat taxes. Ruth asked, what are your thoughts on a tax on industrially farmed meat? And she specifies industrially farmed meat, so that was exempt high wealth organic meat. And there's another question from Stephen. And he asked about what you think about the proposals that have been developed in the Netherlands, which are to introduce a meat tax and use the revenue to subsidize fruit and vegetables as a means of reducing greenhouse gas emissions and to improve health. And he says, I understand that 70% of consumers in Germany, France, and the Netherlands would support such a tax.
Mm-hmm. I would too. That's my answer. I think they should try it. Yep.
And that's presumably because you think it has a chance of working.
Yeah, I think it would change behaviors, you know, and also shift the supply side. and reduce the industrialized, the share of meat that will be industrialized. And so for a number of different reasons, I think it's going to, like I said, it's going to affect both the demand and supply side. It's not just going to affect, we usually only think about the demand side, but it's actually also going to affect the supply side. And I think growing and pretty clear health outcome, studies that talk about the health outcomes associated with industrialized, particularly processed and red meat consumption, and also the environmental impacts, right? So I think if one were, and some people have done the calculations on the cost of the environmental cost is actually really quite large. So yeah, I think if countries think it's possible to implement and to do, that would be great to see it go in. And I'm hoping people will be doing the evaluations for those and start to add to the evidence.
And then Paulina's got a point about water. She makes the point, she says part of the problem in Mexico is that companies producing SSBs manage water access in vulnerable areas, she says. Do you think that the fiscal approaches can address the climatic issue of water scarcity as well?
Yeah, I mean, essentially, I think this provides, if there's good ways to document what's happening in countries like Mexico and also actually in Colombia about water scarcity and how, corporations are basically directing those water resources for their own productions and profits. That should be documented and actually used as part of the calculations for informing on the level of the tax, because essentially, the cost is being borne by society, right? And so, in a sense, the tax revenue then should make up for that.
Okay, thank you. We've only got just a few minutes left. Unfortunately, I'm sorry to some of the questions I'm not going to be able to pose to Shu Wen, but there's 2 or 3 that I will ask that we do have time for. And there's a couple of questions on the theme about what happens when you implement a tax that might undermine it. And the first one is from Milorad. It says, is there evidence from around the world that too high a tax can trigger emergence of counterfeit products, which obviously serve to undermine that? And it reminds me of what's just happened in Norway, I think a week or so ago. I don't know whether you saw that, but Norway have said that they're going to get rid of their sugary drinks tax on the basis that it's just meaning that you get more imports from Sweden or whatever the neighboring countries. In other words, it's undermined by these other products. And Naomi's got a point about where she's using the example of the alcohol minimum unit prices for alcohol, which is in place in Scotland. And she makes the point that one of the concerns is that people will just switch to cheaper brands. Mm-hmm. So when you tax something, they just go to cheaper brands. Yeah. And for that reason, she said his minimum prices perhaps could be better. So what is your view about this potential for taxes to be undermined in these various ways and what some of the solutions might be?
Yeah, I mean, like, the audience have alluded to, there's so many different ways that, in this, like the supply side as well as consumers can sort of work around, right? So like I mentioned, I think with the taxes and the cross-border shopping, that is an issue, particularly for smaller geographies, right? And so this is where then I would argue having more comprehensive taxes covering larger geographies would be helpful and prevent that type of cross-border leakage issues. So, if there was an EU-wide type tax, that would limit that more, right? It's not going to bring it down to 0, but it's going to limit it more. I think compared to other, products like tobacco, for example, where this has often been raised as an issue, including illicit trade as well, is that it's really expensive to transport beverages. They're heavy. so it's different in that sense, right? Like, so for regards to beverages, that's the case. I think with other foods, it's less clear depending on what the product you're talking about is, and the value of it by weight, in a sense, right? But so I think you may have different responses depending on what type of a text, what products the text covers, I guess. And so there's going to be, it's not a straightforward answer. I think it just really depends on how people respond. And then I guess the other way that has been identified, what was the second one that was mentioned? Can you repeat that, Corinna?
There was about making counterfeit products.
That's right. Yeah. I hope that would be where, countries, food agencies will really have a role to play. I think the enforcement and penalties associated with these behaviors really will need to be extreme and like pretty high in order to discourage those behaviors. Yeah, I think with foods, hopefully, people are less likely to do that, but it does happen, right? Like there have been examples in South Africa and China about milk, for example, and also some meats that are counterfeit. So it's never going to be possible to prevent it altogether. But I think it would be useful to think through the enforcement and penalties in order to minimize it.
Thank you. And we're at time, but I just do want to sneak in one last question from Johan, who says, do you witness countries where the revenues from taxes have been redirected to fund specific programs supporting healthy eating habits?
Yeah, specific to healthy eating habits, no. So I mentioned Thai Health, which uses a portion of the tax revenue from alcohol, tobacco, and then now their SSB tax as well, that goes into this foundation called Thai Health, and they are using it for health promotion activities, which could include supporting some health, healthy eating and healthy diets. Within the US, with the local taxes that have occurred in some locations, the way they've done it, because it's it's a different jurisdiction level, right? It's at the local level. When they proposed the tax, the ordinance that came with the tax included the formation of community advisory boards, which would determine the use of the revenue. And the community advisory boards included members of the community plus public health professionals and doctors who then helped shape like how the revenue would be used. And in many cases, they have directed it towards several different types of health promoting activities. So, some of it was building more infrastructure base to build safer and better physical activity options. And then some of it was used actually towards, with COVID, towards providing food vouchers for low-income households in your community. And then in Philadelphia, it was actually very clear from the beginning, the mayor, one of the big pushes from the mayor was actually, he was very that's how he sold the SSB, the beverage tax in Philadelphia, was that part of that revenue was going to go towards expanding pre-kindergarten slots, for low-income households in Philadelphia. So that's not directly health related, but it is health related, right? Like if lower income preschool kids are having access to better care and education, that's going to have longer term health implications. So the answer is sort of yes and no, right? It's not widespread. But there are some examples to build from. So I think there is possibility for that. I think it's important to amplify when these revenue allocations have been used for these kinds of purposes, and then also look at what their downstream effects are, and the multiplicative, effects might be. And so tracking the revenue use and allocation is also really important. So it's something that we actually haven't done in the countries I've worked in, part of which, because these national level taxes, they have not been earmarked. So it's actually very difficult to track then where the money then ends up going and what's it being used for.
Great, well, thank you. And thanks for your very comprehensive answers. And thanks to the participants, audience tonight for staying on a little bit longer, and to you, Shu Wen. There was a lot of questions there, and I'm very sorry I wasn't able to ask all of them, but there was certainly a lot. And certainly I've learned a huge amount about some of the details, some of the ideas, some of the prospects for the future about taxes and subsidies and incentives. And I'm sure everybody who's attended has. So thanks to the audience for attending and for your excellent questions. That certainly was quite a grilling for Shu Wen there. And thank you to Shu Wen for such an excellent presentation and for patiently answering all of those questions so well. So thank you, everyone, and have a good rest of day.
Thanks, everyone.
Thank you. Thanks a lot. Bye.